Hi, good evening, everyone. Thank you so much for joining us. My name is Tanae Lynn Harris, and I am the co founder of the Bloom Collective in Baltimore City. I'm so excited, or I don't know if excited is as much as a term, but I'm excited to have this panel of guests as we are going through this changing tide of coronavirus. We all collectively spoke and thought it was extremely important as we were hearing from our communities, as we were hearing from our patients and clients. What are the ways and how we can support each other? So I'm excited to have Dr. Cecilia Tamori join us, and also Dr. Sakita Lewis Johnson. Dr. Cecilia Tamori is an associate professor and director of global public health and community health at Johns Hopkins School of Nursing. She is an expert on maternal child health who has been writing and doing outreach on the impact of COVID-19 on birthing and postpartum people, their families, and communities. Um, Also have Dr. Sakita Lewis Johnson, who is a board certified family nurse practitioner, lactation consultant, educator, and birth doula. She is the accredited provider program director for lactation education resources. And Sakita has over 20 years of experience in maternal child nursing with her primary focus as a labor and delivery nurse. Thank you, Dr. Tamori and Dr. Sakita, as I know you like to be called. Just so people know, I'm not going against her name. That's how she likes to be called. Thank you so much for joining us. It's really, really great to be here with you all, particularly, in this time and in this moment. And so I guess we'll go ahead and get it kicked off so we can honor everyone's time. Um, Dr. Tamori, can you explain? A lot of folks have a lot of questions. Can you explain the difference between the variants? What's the deal with this new one? Omicron. We recognize the disconnect between information within the academy and institutions and within community, and really thinking of what is critical for folks to know and what are some of the myths that need to be debunked at this time.
Thank you so much for having us. There's so much rapidly changing information. We've seen this before in the pandemic. We worked together, Sakita and I, and trying with others, trying to get this kind of rapidly changing information out before. And I think what's changed with this particular variant is how rapidly it's spread. So when we first heard about it, you may remember it was, right around Thanksgiving. Everybody was sort of in this holiday spirit. We were not feeling great, to be frank, at that time, because things were not looking that great. And we were worried. Many of us were worried about what's going to happen after people get together for the holidays. We did not at that point, really know yet what was happening until our colleagues, our wonderful colleagues in South Africa, let the world know. And, and just reinforcing the fact that we are so grateful to these colleagues and that they then got travel bans instead of, applause, but they should have gotten a giant prize for telling us, what was going on, because we wouldn't have known how to prepare. And anything that we do from there is really in different countries' hands, but they really were amazing. I mean, they've been basically working, I think, without sleep, getting all the data to everyone else so that the world can prepare as best as possible. And so what they saw was this very rapid spread. And to give you sort of some of the visual of that, it looks, a lot of people have called it sort of like almost like a hockey stick, these straight up kind of curves of cases. And what we are also worried about is when you have so many infections, even when you have, potentially a less severe virus, which we'll talk about in a second, when you have a lot of infection, even a small portion of those, if they end up being severe, you will end up with lots and lots of people in the hospitals, right? Lots of people getting sick, lots of people potentially dying, lots of people who are potentially infected and somewhat sick, maybe not as acutely, but also seeking care at the same time. Now, when other people are getting sick, because that happens at the same time, and everybody is trying to get to the hospital, but your hospitals are overwhelmed with people who are ill from COVID at the same time, then that really means that no one's getting the kind of care that you want to have, right? You are overstretched, and, and Sakita can comment on what that looks like in a hospital system, but it can be devastating. People can be dying in the hallway. This is happening right now in several parts of the country. And so the big concern that we have is the rapid spread. And even, again, trying to identify what proportion of those people will get sick. And I can talk about that in just a second, because that's also rapidly evolving. But again, that number, if you have a very large number of infections, you're going to still have a large number of people getting sick at the same time. And so what we're seeing right now is that rapid spread. And in many, many places, including for those of us who are in Maryland and for those of us who are in Michigan and other areas, you're seeing very, very sharp increases, not only in cases, unfortunately, but also in hospitalizations. And that is very worrisome. For the part about severity, this is going to be a little bit tricky because that information is coming extremely fast. You're going to be seeing these headlines, and you've already seen some where people said, well, it's milder. Isn't that great? You know, it may be somewhat, but why? Is it because of the actual virus changing that way? Or is it because people have some level of immunity from vaccination and or previous infection so that the actual virus, if it enters somebody who's had neither of those, can cause equally severe disease? And that's sort of where we are right now with the knowledge. This may change. So I'm making a disclaimer right now. This in a week we will know a lot more. But what that means still is that in a country where we have large numbers of people who have not been vaccinated, and that includes people who are not eligible to be vaccinated, so all children under 5, people who may be immunocompromised, so they may have gotten vaccinated, but they do not have the full protection from the vaccine, to a whole bunch of other people. And most importantly, for our talk today, we know that the vast majority of people who are pregnant are not vaccinated. And I mean the vast majority, like, anywhere from it's close to 70% of total of people who have not been vaccinated. So in that group of people who are already at high risk of severe disease, because during pregnancy, COVID can just wreak havoc with people, huge elevated risk of complications, huge elevated risk of death, risk of stillbirth, risk of preterm birth, and a whole series of complications, some of which we will not even know for years to come based on some of the preliminary data that we're seeing. We don't want any of those people to become infected, especially in that group of people who have no protection. But even those who are vaccinated, we don't completely know in pregnant people how much protection they will have against severe disease because we don't have that data quite yet, right? That is not a gamble that we want to take. The infants, right, who are okay and they're able to arrive are also unvaccinated. So this group of people, the people that we all work with and we're so committed to serving, are at very, very high risk of becoming infected with this very, very rapidly spreading virus. And all of these people rely on the rest of us to protect them. And we're not doing that great of a job. So I think that's sort of the very brief scientific summary, and then we can come back to, elements that are not clear, but those are the main reasons why we are concerned.
Thank you for that, Dr. Tamori. Sakita, is there anything you'd like to add to that?
No, there's not much that I would like to add, but I think Dr. Tamori um, kind of segued into our next discussion
Yeah.
um, about Black pregnant people um, and knowing the historical trauma. Um, and this is like as just was explained, hardest hit group prior to the pandemic when it came to maternal morbidity and mortality, um, as well as infant morbidity and mortality. And so I think just wanting pregnant people, what I would like for them to know is to know the facts about what we know. So means that this is a living germ, so to speak, bug that wants to continue to live, right? And so, there's this thought that, it keeps changing. And I can see people having trepidation based on past trauma, past harm. This data keeps changing or they don't know. But I would want pregnant folks to find someone reputable that does know and really have a meaningful conversation for what it means to their health. And so I want to talk a little bit about from the health literacy standpoint, for instance. We know, so this is one thing we do know, is that folks with comorbidities, right, usually generally have a harder time dealing with this thing, right? Think about a pregnant person with comorbidities, right? And so what I say to pregnant people is that there's the risk, but then there could be even greater risk. And so if you um and this is somebody that's non-biased. I would want all pregnant people to have a conversation about it to be able to make an informed choice. The other thing I would want pregnant people to know is that and I'm going to preface this as saying, because this is the thing that I hear the most, is about the Tuskegee. But there's been a lot of more harms. Trust me, there's been a lot of research that's been done, but this is the one that I hear the most. What I want to say is that um, research has come a long way with protections. Research has come a long way with protections. So I want to validate the past trauma, past harm, but also bring into the conversation, how do we know about the safety of vaccines now? Like having those discussions with people instead of just assuming that they know that that there's an IRB review board, that there's an ethics committee, that there's all these things people so we take for granted. And so I would want pregnant people to do those things. And then the last thing I want to add to this is that and this question, and I don't know, maybe you should read the question today because I just kind of went on in. But what we're discussing is vaccination rates that are low for Black pregnant people, knowing the trauma and harm. What do we want them to know? And what do we recommend that they do to protect themselves, their families, and community? And so I want to speak to also the recommend to protect themselves, their families, and their communities. And that is to have that informed conversation, but also to protect yourself. So we talk about vaccinations, but also mask. Great masks are important. And when I talk about mask, I talk about the importance of wearing the mask correctly, making sure it's sealed. I have been seeing masks below the nose, and I've been saying, like, this is a respiratory thing, right? Do people know you inhale through your nose, right? And so I make the assumption that people know that but maybe they don't, right? And so really just not making any assumptions, but doing the multi-layered approach, as Dr. Tamori has talked about mask, hand washing still, safe social distancing, not really going places you don't really where there's lots of folk, knowing that there's a greater risk of developing severe illness for Black pregnant women, people as
Yeah.
well.
Yeah, it's interesting when you mentioned the Tuskegee study, which is very real. I think in the everydayness of like Black and brown folks, right? They're like, now all of a sudden they care about our well being, but they can't contend with racism,
Right.
right? And how it is causing harm to us. Like, that's the everyday kind of conversation that we are hearing folks say that they're wrestling with, right? I would have to say, I was wrestling with that too. Like, do you know that racism is a public health crisis? Like, do you know, are you willing to contend with that? But that is like a real question. I don't always hear as many folks, particularly here in Baltimore, who always go to Tuskegee. Like, when you understand Baltimore, folks is in the trenches and they're seeing this every single day, right? In so many, complex ways. But it is that how like what I think is so important and critical when we were initially having this conversation was centering that collective care, right? How do we hold so much of the both and within the conversation, and how do we give folks the best tools to be able to, so if you deeply feel you're not going to get vaccinated right now, okay, can we get you a N95? Can we help you build up your immune system? Can we help get you at home tests, rapid tests? And that also goes, Dr. Tamori and Sakita, I know you talk about this a lot, the inequities, right? Not having the access, which is extremely critical to the ongoing conversation. And Dr. Tamori, I know just recently you did a presentation and you were having the conversation around those inequities. And do you mind kind of hinting at some of that a little bit?
Absolutely. I mean, I think this is like the perfect storm, right? It is literally, the manifestation of structural racism, like right in front of us. And it's exactly what Sakita was saying, that the inequities were there before. I mean, so for anyone who's just recently discovered this, I mean, welcome, but it's been there. It's been there from the beginning. This is what the country is built upon, right? And so those inequities have just deepened. They've just deepened further. And in the piece about vaccination, it is so obvious because there's this multiple layers of inequities upon inequities, right? So to begin with, pregnant and lactating people weren't even included in the trials. I mean, and we talked about this before in a previous discussion. I mean, that is a terrible thing, right? Because look, everybody else is getting information. These people weren't even getting anything, and then the guidance was kind of unclear and people were not really getting information. And we know that because of those inequities in the beginning, that were pre-COVID, everything else was coming in this profoundly unequal way throughout the entire pandemic. And then, we had an administration that actively didn't want to support any efforts to, uproot those inequities. The sad thing about what's been happening in 2021 is that we didn't have enough of the attention that we wanted to these inequities in those vaccination campaigns. And many of us, I'm not alone in raising concerns about that, from the way that, mass vaccination centers were set up, where people couldn't get to them, not having paid leave to be able to, take time off to get vaccinated, to deal with the side effects that we know exist that are not severe, much better than COVID. But, if you have to take time off from work and you can't afford that, that's a real problem. So I think that in this case, for pregnant people and for people who are recently pregnant, so people who are breastfeeding too, people who are postpartum, people have not had adequate information to be able to make those informed decisions that Sakita said. I mean, people didn't realize, they weren't really told until the first real advisory from the CDC about how severe the cases was in August. There was warning before, but nothing concerted. And I have not seen much outreach in the last few weeks or months, specifically to this group of people and to communities who have been systematically overlooked. Black communities, Latinx communities, migrant communities from all over, people who have insecure housing. I mean, we're dealing with such profound inequities right now. It is not a surprise, right? And so within those, the 35% or so of the pregnant people that we're tracking, because by the way, we don't even have data on how many people who are breastfeeding have been vaccinated. I don't have that because it's not systematically tracked as far as I can see. But among pregnant people, within those 35%, we have huge inequities. So while for white people and for Hispanic people, they're converging at a somewhat higher rate, for Black women, those rates are lower. And it is not a surprise. And any of us could have told them that this was going to be the case because of the history of profound exploitation that isn't just historical, but contemporary often. So, I just think, none of this is in the past. It's like right here, right now, and people know it and live with it. And so for us to not acknowledge those barriers and not do our work and bring the information to communities, I think is a failure. And that is part of the reason why I'm doing this kind of work, because I think that people deserve better. And for those of us who want people to survive, and I mean like literally, I do not want to see any more pregnant people dying. I don't want to tell you the stories that I hear from my healthcare worker colleagues from the front lines about pregnant people dying. They're horrible, horrible stories. Sakita knows some of them. I get texts from colleagues who have, people on extra intensive care, who are not going to make it, who have lost their fetus, who have had a stillbirth. These are absolutely horrific, and they are horrible for the person who's died. They're horrible for their children who have been left behind. They're horrible for their spouses, their entire family and community. This is not just one person who's lost. It's harming entire communities. And this is why I'm here. I think the key here is, what can I do to help bring the information so that people can make those decisions, so that the layers of protection can be set up. So what would we want to recommend? If you have been on the fence and you're not sure because you just wanted to wait to see, and you were not sure, do they really have good data on this? I will be here to tell you that these vaccines are safe, they are effective, they can save your life, and they are absolutely worth getting. Not only will they protect you, but you will also protect the fetus, because the immunity from the vaccine passes to the fetus, which I think is pretty darn cool. And if you have given birth already and you are breastfeeding, you can again pass some more protection to that infant who again does not have any other options, because remember, they are not eligible to be vaccinated. So step one, if you've been on the fence and if you need help making that decision, reach out and talk to a healthcare provider. But I'm here. You can also reach out and I will talk you through it. Get that first dose of vaccine as soon as you can. Get the second dose as soon as you can. Those of you who have been vaccinated and you were excited about it, or you were not sure, but you got it done, if you've had several months from that vaccine, you're eligible to get your booster. And the booster is really important against this particular variant, because we know that the 2 doses are not quite enough to protect you from infection. It will still help you stay out of the hospital, thank goodness, and from dying. Great. That's what we want. But we also don't really want you to become infected or even have what's called a mild case, which may not be so mild. To not be in the hospital, you can still be pretty darn sick. So we would like you to also get that third dose. And eventually what we think might happen is that we might have to have that kind of dosing, just like with the flu vaccine. So to keep up with what's happening because of these very rapidly spreading viruses. So your first line of protection is vaccines. If you're not sure and you're still on the fence and you're working through it and you're not ready to talk, your second layer of protection is exactly what Sakita said, a high filtration mask, which can also save your life. So even if you're vaccinated, we recommend using the mask in addition to it. If you're not vaccinated, then we really, really recommend it, because it's like your only form of protection from this thing. And so those masks are special. They're not cloth masks. They're not like the surgical masks that you sometimes have seen in TV shows, right? They are extra quality so that they filter those small little viruses very well. And Project N95 is a great place to find them, and we will try and see what we can do to get some masks to the hands of community members. We also have written a letter with a whole bunch of public health experts to the White House to help us bring free masks to people and to help us with policies in places in the public. Like if you're working in a place and there's no way to have people wear that mask, then that really isn't adequate. So we're working to try to use those kinds of policy changes, hopefully, to protect more people who can't be protected otherwise. But whatever you can do, whenever you are elsewhere outside of your house, you should be wearing that high filtration mask. And honestly, in light of where we are and the level of transmission that's happening, I would not recommend, especially this group of people, to be in places like indoor dining or any of those. She's shaking her head too, so she's on the same page. I think that because you have to take your mask off. And once you take your mask off, you're breathing in those particles, and those particles, they can linger in the air for a while. So it's not enough to kind of stay away from someone. The piece about air and making sure that the air that you're breathing isn't full of viral particles from other people, the mask is a great protection. I would also encourage people, if they want to hang out with people, to go outside. I know it's cold, but being cold is a lot better than being in the hospital. So outside, you can take a walk, put on a coat, put on a hat. Or if you're inside, open the window. That will also help. Or there are instructions online, and I can share those links with you about, how to build your own sort of home air filter. You don't need a fancy one. It doesn't cost a lot of money. They should be free. But, since we don't have that, we can help make lower cost ones to make sure that the air is filtered. So those would be, some of the things that people can do. And then, obviously we'll talk more about how to navigate, gatherings, but multiple layers, one upon the other, and trying to minimize those kinds of opportunities for the virus to come in, like crowds inside. The main sources that I've been hearing about from my healthcare worker friends: restaurants, bars, places where people hang out and chat and eat, because then they're not wearing a mask. Those would be some of the very common events of transmission.
Yeah, I think what goes back to so much of what you and Sakita have been saying, it's like also the folks who are vaccinated and they're like, oh, I'm vaccinated. I got my second dose and my booster. And I'm just going to go to the bars and the restaurants and have a good time because the narrative says it's the people who are unvaccinated who are spreading it, right? And it's so important, and particularly when we're thinking about going into the holiday season and folks is like, oh, you Debbie Downers messing up our holiday, time together. And I think that's what's so hard for folks is like, they're like, there's so much information or non-information that's there. I'm going to go with the thing that's going to make me feel most comfortable. And that's going to be time with my family and loved ones, right? Because I'm not hearing so much. And so thinking of that, what are some, Dr. Tamora, you've already shared so much, but like, as people are thinking about their holidays, like what are some very clear and concrete things that folks should really be considering, or even some possible shifts? Folks may have wanted to have 10 or they were planning to have 10 to 12 folks over that don't live in their household. How should they try to navigate or mitigate some of that exposure?
Yeah, absolutely. So I think my kind of phrase of the day is less is more. So, reduce,
Yeah.
So if you don't have to go anywhere, this is really not a great time to be going all over the place. Again, partly because even if you don't get COVID, if anything happens, healthcare wise, it's going to be a real challenge in many places to get care. Not great situation in hospitals unfolding, people waiting in the ER. You might be exposed to somebody there. I mean, it's just not an ideal scenario. Obviously, if you need help, please go to the ER. I'm saying wear a mask. But, for the holidays, reduce, if you can avoid traveling. I think, for this group of people in particular, it's probably best to limit that kind of activity. In terms of the scale of celebrations, fewer the better. So fewer households mixing reduces your risk because you have fewer possibilities of somebody being infected. So reduce that number. And then, we all wanted to be able to have rapid tests before the gathering, but as far as I can tell, there aren't any. I mean, there are not any
They're sold
around.
out. They were sold out.
Why? Yeah, I can't. So
There's none, right? So
there's, yeah.
I mean, there's not a lot. So, and they're expensive. They're expensive. So again, and I was really, really frustrated. You already know this if you follow me on Twitter, because, this is the kind of thing, like getting people free opportunities to reduce their own risk and their families and their communities is what we should be doing. And it should always be about equity first, not for people who can afford to do stuff, like that's great. They can find out the best kind of mask, the most expensive, all that cool stuff. That's not the main concern. The main concern is people who don't have those resources. That should be first. That's not happening. And so as a result, if you have a rapid test, which would be wonderful, then you could test like right before that gathering. And I mean right before, so like you could test like right before you leave the house, or, before the person, when they're in the car, to test everybody. If they're positive, don't go. Right. But the tricky thing with rapid tests is that you can't always count on them, because partly you could become infectious pretty quickly, possibly in the matter of hours, which I have, seen from fellow healthcare workers. So, you don't want it to be the only, layer, but it can help reduce that risk if they are available. But I will tell you that we don't have any either. So that's not happening. So if you have any symptoms at all, like any respiratory symptoms or any of the many kind of, if you're feeling ill, if anybody else is feeling ill with anything, I would just say, don't do it. Then don't gather. That's the one clear way that should be avoided. Again, you can add that layer with the rapid test, reduce the number of families getting together, and encourage everyone to have those conversations so that hopefully everybody is vaccinated. I think for our group of people, if we are having other people who are unvaccinated and we're in a gathering, that's going to make it particularly risky for, pregnant people and, recently giving birth people. And so in that case, wear a mask and consider like some creative things, such as taking the food home, gathering and hanging out. Again, open that window. You can still spend time with each other, but then if you take the food home, you don't have to take the mask off. So that's kind of a creative workaround. I don't know, Sakita, what do you think?
Yeah. So I want to speak to that, but I want to speak to a couple other things Tanae brought up. But I recall in the past, it's in the summertime, when I did a celebration for my son, and I had all the foods individually wrapped, period. It was all wrapped. So the cupcakes was all specially
Contained.
wrapped. Yep. The subs were contained, right? Even like making a salad, I brought little containers. We had some type of pasta salad. Okay, I scooped those in the little containers, right? So anyways, so I'm not advocating for like having get-togethers, but in June our numbers were not as high. But I do want to go back tonight and speak to the narrative about just getting shots in arms is what I hear a lot. And also the narrative about it's the unvaccinated folks. And so it's like, what do I do? What do I do? And so, from a standpoint of really from leadership, there should be a shared language. There should be a shared message because all of that adds to it. And so it is causing some trepidation of folks regarding even getting the vaccine because there is not one unified message. So the narrative needs to be real clear. And it's not clear. And I'm just going to be honest, it is not clear whatsoever. Part of the reason I understand it's not clear. So part of the reason as a clinician, I get it. Research is changing. This thing is just mutating and blah, 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 blah. But as someone that's a patient or on the other side of that. So I want to talk about that. Our infrastructure is ridiculous. And I want to speak to it from the standpoint of infant feeding. Right now, in the city, not the city, the state of Michigan. Oh, it's been a long day. The state of Michigan, there is a shortage, and I'm not going to say which company it is, but it is the one that our state is currently under the Women and Infant WIC program. That's alarming. Now, and I'm not saying it's alarming because I'm a formula pusher. I'm saying it's alarming because people lack adequate lactation assistance and support. And our system wasn't set up infrastructure wise, period, for infant and young child feeding during emergencies. And it's still not. And we've had a couple years to address it, and we still haven't. And so when I think about the message that I would say to someone who is lactating, it would be all about infant feeding. It would all be all about protecting your milk supply. It would be all about seeking a pregnant person right now. Where's your lactation team? Build it. Reach out to someone. Let's get an assessment going to see if we can anticipate if there are going to be problems with lactation. And if so, maybe we can have a plan in place, right? Digging into community. We frown down on informal milk sharing, but informal milk sharing built this country. So there's so much that today when you were talking, it was so much that was just popcorning up in my head about how this is being managed and why people feel so strongly one way or another. And that is because of the inequities. That is because right now, yes, if you can afford to go get masks and all of that stuff, do that stuff. But the average family cannot, particularly with the way the economy has been. The average family don't want to say, let us all just eat at home alone. And maybe next year. And because we're not doing that each year, like I remember us being in this situation last year, but last year it was crucial. But this year I do feel like it's on fire. This year I feel like I'm running out of steam as a person trying to navigate understanding the needs of community, but also understanding the needs of my colleagues that are on the front line. How can we get communities to align with healthcare professionals when it seems like there's this fighting, right? And there's this fighting. Why? Because there's not a shared language, because we're all saying 5 million different things, and because we're expecting the layperson to know what to do with all of these things being said and the narratives that are being pushed. It's alarming.
Yeah.
And I don't know. I'm gonna get off my soapbox right now, but
No, that's not a soapbox. That's a critical thing. People are constantly asking. Like folks are like, I'm hearing this. I'm hearing that and I don't know which way. But my heart says I want to be with my family, right? And that's what they want because they're like, they need that TLC, that tender loving care. That's what folks are looking for. I mean, Sakita, when we saw each other for the training this summer, it was like, we got our N95s. We gonna hug and we that's the real human interaction that comes out of it because you're like, well, we gonna hug and share some. But it wasn't just like a hug, it was a full embrace because we knew we needed it, right? And that's what folks are saying. They need that nourishment. And that nourishment isn't just coming from the food, which I think is a fantastic. Like we did the same thing for our trainings. Everything was individually packed, eat your food, put that mask back on, go wash your hands, do all the things. But it is that folks are really looking for what is their best course of action. And you're so right to have a unified messaging. Then even how folks, when we're even thinking about this conversation of collective care, of like how we're talking about people and not realizing that we're equally causing harm. Like you are becoming the thing that you're saying you're trying to stay against. So like for us, for Bloom, we won't always talk, like we understand the Black maternal mortality and morbidity crisis, right? The infant mortality crisis as well. But we won't always talk about it. We won't always post about it on social media. Why? Because our clients are paying attention and they're already harmed from the narrative, right? And so how do we have constant communication and conversation that's a little bit different? And so when you're telling folks like, oh, you're an idiot because you're not vaccinated, that's not tender loving care. Do you ever think that calling someone a fool or whatever you're going to call them is not going to get them to the best course of action? And so when we're thinking of collective care, even thinking about Bell Hooks, may she rest in peace, like how she understood collective care and love and community and being with one another. And I do think so many of us have to think about the way and how we're communicating with each other. Sakita, I think you just said it so profoundly, of having that solid messaging is extremely critical. And I think that if we don't get a lot of this right, we've talked about this several times, that we're going to have to contend with this years to come because we haven't provided that space. Like the harmful things that we're saying to folks are going to continue to roll itself out through years to come because of that.
I would say that we're contending with it now.
Mm.
As I know right now, 3 people that are battling this thing.
Mm-hmm.
We're contending with it now.
Right.
The deaths, hospitals. It is something to reckon with, that we need the leaders to step up. We need something to be done about the misinformation. It is, I don't know what that thing is, but what I will say is that if we continue on the route that we are now, with not coming to a shared language, without outreach, without folks going into the communities and really talking to people and having these meaningful dialogues and conversation, and also having the compassion to understand what their fears are. And Tanae, you hit the nail on the head when you started. You said it is like, folks care about us now, you know and so I think about it from, you know even from a standpoint of health. The health of a people in a nation is national security, right? And we're not really thinking. Everyone is thinking about this, their individualized ways of doing, being, and thinking. And um that's the part that it's hard as a clinician to contend with. Even as I am thinking about, this is the first time that I've ever been scared now, like seriously, and I'm admitting this publicly, to go into homes now. Like, when I remember when it first started, not going into anybody's home was not an option. But it's almost like I can have this collective type of thought, this community type of thought, but does the community care, right? About those that are putting themselves on the line? And then, as the patient who have to go to these hospitals, myself, who couldn't even went in for chest pain and couldn't even be seen,
Mhm.
like thinking I'm about to die. Like, when does this end? We're contended with it now. ERs are stretched. Um, what do we call urgent care centers are stretched. Urgent care centers can't handle everything. If you go to an urgent care center with chest pain, they're going to still send you to the ER. Like, these are things that, folks are hearing, ER is busy, so I'm going to go to the urgent care. Well, urgent care can't handle everything. So we're contended with it now. And yeah, that's
I agree with you 100%. I don't think I don't, when you said it was a soapbox, I was like, no, actually, it's just the truth. It's very hard. It's very hard when that is not what's on the front page. Like I said, I mean, we've been talking about this for many months now, and Michigan has been in crisis for many months now, and it hardly ever makes the news. Rhode Island, literally people were dying in hallways, barely is making national news, and instead we have these things about like, what is your individual risk of blah? Like, can I take my vacation to whatever? Like, I'm sorry, let's like take a step back. you know, what do we need to do? How do we need to help the people who might be the ones ending up in those hospitals right now? How are we going to help the healthcare workers who are trying to take care of folks who are dying or who are very seriously ill? I mean, these are not trivial kinds of questions. And so I am so in agreement, and I had this I actually wrote a whole thread on like, who are the unvaccinated and broke it down, like this kind of language is stigmatizing. It is blaming people, many of whom are, you know, at various kinds of disadvantage, right? Like when you're being evicted, I don't think that vaccination is like your number one priority. I'm sorry. Like, that's why we need, safe housing for people. That's actually a pandemic policy that we can do. So, not to mention, like I said, children, I mean, they're not even eligible or they rely on their parents. All our folks who've been, targeted systematically for months by misinformation that we haven't addressed, which by the way, they could address. I mean, that's what these big tech companies can do, so they should do it because we've seen it all. I mean, my goodness, the things that people say, some of whom claim to be health professionals. I mean, they're hideous things, that are complete lies, but they're preying on people and then people die. I mean, so I think a change in course is long overdue. It was long overdue before Delta hit us. But in this situation, and I think this is the part that's not getting through right now, said we really are. We're in a big surge. It's fast. We don't know all the implications. We, in fact, don't need to know all the implications to act now. And so we want people to be able to connect with others, but we also don't want them to die. And to do that well, we have to talk to people where they are, right? And telling them that they're like, ignorant or evil or, I don't even know the things that people say. I just am shocked sometimes, It's a complete lack of understanding of what people are dealing with and the kinds of systematic misinformation that's been targeting people for months.
yeah.
We shouldn't be surprised. Why are we surprised? How can you navigate when it's so confusing as it is? It is not simple. And the data speak for themselves. I mean, look at our data for pregnant people.
Yeah.
That to me is the evidence is the outcome, right? And the outcome shows that we haven't done a good job. So we have to do better. And the only way to do better is to actually talk to people about exactly what's going on. Like Sakita said, what are people afraid of? We're here to answer those questions, you know? Because, and like people have to care enough that whoever, like, do we really think it's okay for people to just die? I mean, I'm not okay with that. So, it's just not acceptable.
I do want to just mention a couple things that we have not talked about, and sometimes I do this, and I'm guilty of this. I make the mistake that folks know the symptoms, and so the one thing about Omicron is that, back when we first started hearing about this loss of taste and smell was a very common thing for some and not for others. But with this is less, it's not as common. And the other thing is those that are vaccinated, if you do become infected, your symptoms might resemble like a common cold, which is cough, fatigue, congestion, and runny nose. The reason why I think this is so important is because allergies also gives us those three symptoms. So if you are a person who suffers from allergies, you might write off those symptoms and be like, it's just my allergies acting up. I can go to this family gathering. So I wanted to bring those things to the forefront. Um, and I didn't want to miss this opportunity to do so.
That's why you're such a good provider. Because you don't,
Thank you.
you bring that stuff up, which I totally would have been like, oh yeah, I forgot. But yeah,
Thank
it's
you.
so important. It's so important. So don't, yeah, anything that's like, that may seem slightly off. This is the time not to ignore that. 100%. Like, don't assume. And because we're all gonna be out of rapid tests, I think it's the safest option. If obviously, if you have any symptoms at all, you don't need a rapid test to know that this is not the time. Just postpone, and hopefully we'll have no more information, more ways to protect people. I think for anyone who is unvaccinated right now and you're not sure, you're on the fence, reach out. We'll talk to you, we'll help you. But in the meantime, definitely reduce those contacts as much as possible, because what we do see so far in the data is that it can make you very sick. So don't assume when you see those headlines. I think that was one of the big takeaways, that you'll be hearing this. I've been seeing it all day today. It's milder, blah, blah, blah. That may not work out for people, who are unvaccinated or who have other things going on. So let's not jump that, but this is a very premature kind of thing to say. And I think it doesn't help people make good decisions that can, be like life and death. That's
Yeah.
not something that you really want to, make a bad decision on.
Yeah.
No.
So
I want to stress, so um, to anyone contemplating, getting together. I've been getting texts like, well, what are you planning to do? So I finally just made a post about it, right? But in all honesty, I don't want folks to do what I'm doing. I want folks to be informed about the why we make certain choices. And I know for me, my children were still in school and they've had a few exposures, and I would never ever want to be the source of someone who is asymptomatic, but then someone else gets it. I just and I'm not ready to die myself either. And when I think about inequities, I think about as a Black woman showing up in the hospital. It doesn't matter that I supposedly have this little title over here. None of that matters. I'm a Black woman showing up in the ER with a complaint of pain. And we know what the literature says about what they believe about Black women in pain. And so for me, yes, I will be staying at home with just the people that live in my home. But I want folks who are even contemplating or even thinking about what they should do or what they is to reach out to someone, to a trusted healthcare provider, someone that's going to give you the information that you need, the information how you need it to help you make the best choice and decision for you during this holiday season.
I think that that's such perfect advice. And I will say one more thing about that one. When all of my networks of public health people in like every conversation I know have canceled their plans, that should tell us something. So, whoever's writing whatever op-eds for themselves, like that's nice. Some of them are not even trained. That's another story. But, I will tell you, considering that, all I do now is talk to healthcare providers or public health professionals. Like no one's going anywhere. They're all canceled. They canceled flights. They canceled trips. They're worried about their family members in various places, because people are all over the place. They're worried about their unvaccinated kids because they're not eligible. I mean, they're worried about families with younger and older people because they're worried about what the impact will be on older people who may not have full protection. There are people who have been ill. They're worried about that. And so basically people are saying, okay, you know what? We'll postpone. We're not canceling. We're not saying we're never going to get together. We're checking in because we are having a major surge right now. And we don't know exactly how it's going to play out. But what we think is happening is not good. We don't want anyone to end up in a hospital that's completely overstretched, because we do know what happens then is that more people die, a lot more people die. And we've seen that already. We've seen it in Michigan. We've seen it in many parts of the country. Like we actually have already had that data. We do not need any more data on that, So you can't perform miracles. It's not beds, it's people, right? It's the special healthcare providers who have been frontlining this whole thing, taking care of people. But you can't just like make more of them and save people's lives. If they're not there, there's no capacity. So that's what's been happening in my networks. In case that helps anyone make a decision to postpone, that might not be such a bad idea.
And the other thing I just want to say, and I want to say this on behalf, and I feel it is a responsibility of mine to say this, is be nice to healthcare providers. Most of them are doing the best that they can with what's happening. The time waits, there's nothing that can be done about that. What we can do to help is these multi-layered approaches that Dr. Tamori has been talking about. But if you find yourself having to go seek health care, understand that healthcare providers are just as tired of this. And likewise, healthcare providers, you really need to listen to the community where you are. Listen to what the concerns are and address those. Don't stop thinking you know. Your community is the expert in what they need. So, whoever your reps are that is responsible for outreach in your community, start getting down there, street level, foot level, and figuring this thing out. We have to have compassion both ways. We have to have grace both ways. If not, we will continue to contend with this.
Well, there's so much that we can always continue to say. And I also want to honor everyone's time. We're going after 6 o'clock. But thank you, Dr. Tamori and Sakita, for all you are and all that you do in your intentionality to help provide critical information to the community, and to also help be a bridge from the academy to the institutions and within the community. Um, and so, is there any last words that you two might have before we close out? Just wanted to provide that space.
If there's no urgent questions, I mean, I think Sakita summed it up so nicely. Just reach out. Never be afraid to reach out to, any of us. If you have any questions, feel free to message me on Facebook. Wherever you need me, I will talk you through it. And I've done that for many people. If there's anything that you have questions about, find those people that who are reputable, like she said, people who know, don't just talk to someone who knows what their knowledge might be, but someone who really knows their stuff, in the community that you trust, so that your life and your loved ones' lives can be protected, because that's what we want. That's what we're all here for.
Yeah, and what we'll do, just so folks know, we will kind of gather a lot of those resources, because one of the things that we do want to mitigate is the reality is like folks can't always find them. So I'll get all the resources from you all and even the folks that we're connected to, and we'll add it to the live here that it will consistently aggregate through time and space.
I just want to add this last bit, because I know that it's hurting people in the community that usually get together with their families. I want you to be able to stand firm in your truth. Trust your gut, trust your intuition, but also, um, you know, those who lead support groups. I know that Christmas is happening on a Saturday. For us, we will continue. We will meet to meet the needs of the community, because this is a hard time, and so I don't take it for granted that this is a hard decision to try to figure out what to do. But trust yourself, trust your gut, and just be safe.
Yeah, use that head, that heart, and that gut.
Yeah.
Um, Thank you, Dr. Tamori. Thank you, Sakita, so much. Love and appreciate you all for all of your knowledge, all of your tender loving care and intentionality. And we'll continue these conversations in the next few weeks, but we really thought that it was important to be able to come together and convene as things were changing, they were changing drastically. Particularly here in Baltimore, we constantly heard of community small business owners having to close because of exposure, folks getting sick, loved ones getting sick, community members and clients getting sick. And so we know that this is spreading. And so we wanted to be able to provide some support, some love, and some care to you all. Thank you again for joining us. We appreciate you, and we hope you have a happy holiday, a happy and safe and blessed holiday. And we'll talk to you soon. Thanks so much.